Hello, Andy. So today I just want to discuss about headache in English. Headache is really a headache for everybody. Headache, the main reasons are primary headache, and we can divide it into primary and secondary headache. Primary is the commonest headache. Primary headache is due to without any secondary causes like any there is no infection or inflammation or any brain related or no disease in the body, but still causing headache, so we term it as primary headache. So these are divided into tension type headache and migraine mainly. So tension type headache comprises of 70%. So this tension type headache is it's usually bilateral, I mean two sides of the head constrict something, some tight band like structure, constricting type of headache persists for few hours. There are no associated symptoms in this headache. It is due to because of stress and lack of sleep, lack of physical activity. Sometimes excessive snoring also can cause early morning headaches. So coming to the second common type of headache is migraine. Up to 40% we see migraine is usually unilateral, one-sided headache, throbbing. I mean, we feel like a heartbeat kind of sensation. It is associated with nausea, sometimes vomitings. They can't. They have unusual sensations like they can't tolerate excess light, can't tolerate excess noise. Photophobia, phonophobia, we call. Sometimes headache. This migraine is associated with aura, means some bizarre images they see just before the onset of headache or during the headache, some bizarre images or some black spot in there. So and migraine also can also associated with giddiness. So other types of primary headaches are heat because of heat exhaustion or working in hot environments due to dehydration can cause headache. Too much of exertion, post exertional headache we call. And cluster headache, it's very less common. It's usually seen in males, one-sided unilateral eye lacrimation can be seen, eye watering can be seen. Medication overuse headache, people who use NSAIDs, painkillers over long term, it can also cause headache. And coming to the secondary causes, these are all the least common, like 10% causes, but they are pathological causes. So these causes, sometimes a simple viral infections like dengue, chikungunya, or throat infection, sinus infection can cause headache. Problematic headaches like any clot in the brain, any tumor in the brain, any bleeding in the brain, head injury also can cause headache. Subarachnoid hemorrhage, the coverings in the around the brain, there are blood vessels. Sometimes the blood vessels are weak, they form aneurysms. Sometimes rupture of this, I mean aneurysms spontaneously due to high blood pressure, any injury that can result in subarachnoid hemorrhage. So they describe headache like worst headache ever in the in life. They describe it as thunderclap headache. So other things like brain infections also can cause headache, and other things like vasculitis, brain inflammation of blood vessels in the brain can cause headache, especially 50 more than 50 age group males we see especially temple pain. So that it's called temporal arteritis. In those patients ESR will be high. We confirm the diagnosis with temporal artery biopsy. So these patients will benefit with steroids. And malignant hypertension, blood pressure more than 180 by 120 millimeter of mercury can cause, so it has to be brought down immediately at least by 25%. And glaucoma, increase in the eye pressure also can cause headache. Side changes also can cause headache. So when should we think about the serious causes of underlying disease in such headaches? So patient complaining of new onset of headache, first time headache, worst headache ever seen, or slowly progressing headache over days to weeks, or headache associated with vomiting, that means headache, and fever with neck pain or neck stiffness, any speech disturbances, any double vision, or any weakness of the limbs. So we have, and any vision changes, and age more than 55, and pain over this temple area. So we have to work up with sometimes a CT scan, MRI, brain angiogram. Sometimes if we are suspecting a infection, lumbar puncture, I mean CSF analysis, we have to do sometimes eye testing, eye pressure testing, and vision testing are mandatory, and some blood tests are also mandatory. So to rule out secondary causes. Thank you.